No, you're talking about Goose Foot Tendonitis, also known as knee bursitis. So that's right, guys. We're going to talk about knee bursitis and the things that you can do to help alleviate that pain. Hey, it's Dr. Heather here, and if you haven't subscribed to the channel, please go ahead and do so. As always, if you are a current subscriber, thanks always for watching. So like I said, today we're going to talk about Goose Foot Tendonitis, also known as knee bursitis, where it's an irritation to the Pes Anserine area, which is the sac-filled bursa area that is on the inside part of the knee. So as always, I've provided a diagram down below and you can see it here on the screen. We're going to start talking about the anatomy, getting a better understanding of what's going on and why we would experience this irritation. So as always, I have my friend here, Mr. Super Skeleton. We want to kind of go over the anatomy. Like I said, with the diagram provided, you can kind of get a better sense of why it's called a goose foot, simply because of how those three different tendons come down, and when we draw on the diagram, it does mimic a goose's foot. So like always, guys, we're going to come down, we're going to take a look here at the inside part of the knee. These three tendons do originate themselves off the hip, and they come down here just pretty much right below the top part of the tibia. And this is where the three tendons, we're talking about the sartorius, the gracilis, and the semitendinosus, which is one of the two hamstring muscles, comes down and attaches itself here off that tibia. When these three tendons come together, they make up that goose foot kind of image that you're seeing in the diagram. And a lot of times when we're bending the knee, we've got that twisting action, pivot motion at the knee. These are where these tendons can kind of come together, rub together, and because there is a sac right down here, can also create some irritation and inflammation. That's where you can notice that knee swelling appearance on the inside of the knee is just pretty much basically how those tendons are going ahead and creating some irritation because they're trying to slide and glide over that joint surface. So what I've gone ahead and done is we're going to go ahead and first look at some simple things that you can do at home in terms of stretching and basic static, I should say more of isometric exercises that you can do that are simple to start really alleviating that pain, that discomfort. Then we're going to go into part two. So yep, be paying attention because there is a part two. Once the swelling is down, once you've kind of got a good handle on the stretching and those isometric exercises, like always, we're going to want to take it a step further. We're going to want to really start working on our balance, our proprioception work, because like always, and you hear me address this in all the videos that I've done, we want to work on that kinematic chain. So even though that knee is feeling the discomfort, we want to go ahead and really start working on balance, looking at that foot ankle, which is going to help that knee, and then also too addressing kind of strengthening the hip as well. So like I said, guys, we're going to start with part one first. That's where we're going to dive into the stretching and isometric exercises, and then make sure you do pay attention to part two, where we get a little bit more dynamic and we start progressing a little bit further to really keep that knee bursitis really dormant and away for good. All right, guys, so here we go into part one. So we're talking about goose foot tendonitis, and now we're going to go ahead and look at some of the stretches and isometric exercises that you can do to really help that condition. All right, so what we're going to do now is we're going to go down onto the ground. We're going to start stretching things out. If you have a stretch band, go ahead and use it. If you don't worry, you don't need it. And if you're looking to purchase one, click the link down below. I've left one there for you guys. So what we're gonna do is we're gonna start with some nice basic stretches, and we're gonna go down onto the ground. I'm gonna use a band today to go ahead and help me doing some of the isometric stretches that we're gonna go through for the Pes Anserine area, also known as knee bursitis. So we're gonna come down onto our mat. And when we do these, there's a couple of things that you could do. You could sit up against a wall if you're feeling like your low back is going to get really tired. But what we're going to do is we're going to always have the opposite leg where the foot is flat. That's again just to allow for some stabilization amongst the pelvis. So right now I'm going to go ahead, I'm going to take my straps, I'm going to hook them over my feet. And from here, what I'm going to do is I'm going to apply some tension, and I'm just going to go ahead and stretch out the calf and the back of the leg in this position. So all I'm doing right now is just giving myself a nice stretch to my hamstring. And this might be when the knee is irritated just enough right here. So again, we're just stretching out the foot in this position. So I'm pulling the toes towards me, stretching out the back of the leg, the calf, the hamstring in this position. Now from here, what we could do as well is we could go ahead now and lay on our back and get it into another type of position where we can try to hit that hamstring a little bit more by pulling again the toes down towards you. Opposite leg is flat on the floor. Again, getting that nice stretch going behind the leg here. Okay, now what we can do is we can roll over and we can go ahead and we can hit our quad. So what I'm going to do is I'm going to switch the strap so you guys can see to my opposite foot. I'm going to come roll myself over. So in this position now, I'm going to come down onto the ground and I'm going to take it so that my arm is here, and now I'm going to go ahead and just allow my quad to get stretched in this position. So again, we're just stretching out the calf, stretching out the hamstring, and then stretching out the quad. When the injury is initial and you've got that swelling, this might be enough range of motion for you. So just take it easy, know your limitations in terms of the amount of extension and flexion of the knee that you want to apply when adding pressure. So from there, we're going to go ahead and go into the isometric exercise. First thing we're going to look at doing is actually strengthening up the quad itself, okay? So from here, we're going to do a nice basic easy leg lift exercise. So from here, we're going to have the opposite leg bent. We're going to go ahead, flex the toes towards you, and then just lifting the leg up and down in this position here. Okay, so this is just a nice easy quad stretch, quad strengthening exercise that you can do. You can do it about 20 times. Then from there, we could actually go ahead, hit the VMO a little bit, turn the foot out, and again, just lifting that leg up and down 20 times with the foot turned out. The next thing we want to start to target a little bit more is actually glute and hamstring. So from here, and you've seen this in some other videos, we can come up into our bridge position. And at first, I would recommend just doing a couple bridges here, seeing how your knee feels just in this type of action. Because then the next thing that you are going to try to do is allow for a single leg bridge up. So you're going to put your opposite leg straight up, and now you're lifting the butt up and down on that side. So, if my left leg is the injured side, I'm lifting up and down in this position, allowing for hamstring and glute to really start to engage here. The next thing that we can do is we can go up into our bridge, take our right leg, extend the right leg out, tap the foot, extend the right leg out, tap the foot. I'm going to show you also too with the left side. So here it is again. My left leg is parallel to the floor, I tap the foot, and then I come back and I tap the foot again. So all we're doing is maintaining and holding that bridge position while we go ahead and do this right here. Now, the next thing that we can do from going from more of those static, easy stretches and isometric exercises where we're just starting to get some strengthening going is we can look at engaging with a therapy ball and starting to really attack more of the back of the leg muscles along with balance and proprioception work around the knee. So what we're going to do now is we're going to go through a few back of the leg exercises using a therapy ball. Now when choosing a therapy ball, you want to make sure you choose it accordingly for your size, and because I'm only 5 feet tall, I'm going to use a 55 centimeter therapy ball. And if you're questioning on what size therapy ball you should use, drop a comment down below and I'll happily give you advice on which one to choose. And if you're looking for a good solid therapy ball to purchase, click the link down below and you'll see one available to you. All right, so what we're going to do is we're going to first start with bridge ups, then we're going to go into some hamstring curls, a different type of bridge up, and some single leg lifts. So we're going to come down onto our mat, and we're going to go ahead and put our legs straight out onto the ball. So I always like to go through the basic movements first so you guys can get a better sense of how to do things without going to the most advanced level. So now, when doing balance work with the therapy ball, when my hands are closer to my center of my body, it will be easier. The further away my arms go, or even above my chest, the harder the exercise will be. So today, we're going to keep our hands here at the inside of our body, near the center. We're going to lift our butt up and down 20 times. Now, if the knee is really swollen, putting just this amount of pressure on that lower leg, on that foot ankle, may make the knee uncomfortable. So simply just walk the ball in a little bit will help reduce that amount of pressure on the knee. So from here, we're going to go ahead, we're going to lift our butt up and down 20 times. Notice if your body is shifting or swaying from side to side. You want to focus really having a string, pull your body straight up, straight down. From here, after you've done that, we're going to dig our heels into the ball, dragging the ball in towards our butt. And now what we're doing is we're doing a hamstring curl. And again, you should feel the back of the legs, the hamstring muscles, the glutes, the calves, everything engaging when you do this exercise. Now, we're going to go ahead, place the feet flat on the ball. Now, the trick with this one is to not push the legs out on the ball like so. The idea is to let the feet rest on the ball while we lift the hips up and down in this position, allowing for a bridge position to happen, feeling hamstrings, calves, and glutes engage in this motion. And we're going to repeat this 20 times. The final one we're going to do is some nice, easy, straight leg kicks. So we're going to take the legs, and now I'm going to give myself nice Rockefeller Radio City Music Hall kind of Hall of Fame kind of kicks, where I'm kicking my leg up and down, and the balance leg is having to take a brunt of the work. Again, if the knee is feeling still irritated, you could bring the ball in a little bit, or you might not be ready for this exercise just yet. So that's where to start when you're looking at treating goose foot tendonitis or simply knee bursitis. Start with the basics, start with the stretches, start with some isometric exercises, and then look at getting a little further in advance by adding in some balance. Using a therapy ball will be a great start to that. And if you're looking for more balance exercises to do to really kind of help with that knee bursitis, you can look at the other video I have on my channel for proprioception work. Even though it's designed a little bit more for skiers, the same principles do apply. But if you have any specific questions regarding your knee bursitis, or if you're not sure what's appropriate for you, leave some comments down below. Happy to assist you further. And if you found some of this material helpful today, please do give it a like. And if you haven't gone ahead and subscribed to the channel, please subscribe today. All right, everyone. Hopefully you enjoyed this little bit on goose foot tendonitis.